The increased rise of adult deaths in so many countries means that the number of children orphaned each day is expanding drastically. Nyanza Province, one of Kenya's 8 administrative provinces with a population of roughly 4.4 million, is staggering under the load. She has over the years witnessed a vast number of children left without one or both parents as a result of HIV/AIDS pandemic or related ailments. These orphans are often taken in by extended family members, in most cases elderly women or children themselves head the households. Majority of the people here live below the poverty line, and for families already afflicted by poverty and with no income, it becomes even harder to support the additional children and provide essential food, clothing and school fees. In the year 2008, Care Kenya, a humanitarian agency working to help people achieve social and economic well-being, partnered with Plan Kenya, a children's organization working within communities to alleviate child poverty, to plate and establish a project to combat poverty in the targeted communities of Kisumu West so that every child and household can realize their potential. This saw the birth of community savings mobilization, Cosamo Plus. Cosamo Plus is a rural microfinancial methodology designed by Care Kenya and Plan Kenya following a previous successful implementation of the same by Care Kenya in Homa Bay, Suba, Rachuonyo, Nyando, Migori and Kisumu districts of Nyanza Province. Plan Kenya is the financing arm, while Care Kenya the implementing.
The project aims at introducing savings and entrepreneurial culture to the community. This is a community-managed microfinance that works through resource mobilization. People mobilize their own savings and disburse loans from personal savings. The project aims at improving in a sustainable manner the household economic security of children caregivers in Kisumu West district by developing sustainable group savings and loan project and improving the income generating activities of the group members. This is done through group savings and loan trainings and business management skills development.
The project targets the very poor economically active rural population who cannot access credit services from the commercial banks or the microfinancial institutions to initiate and or improve their income generating activities.
CARE is doing an indirect implementation approach to group savings and loaning methodology. That is whereby community-based trainers are trained by CARE staff on the methodology, and SPM, that is selection, planning and management of income generating activities, and then they roll out the training to the community members. The GSL methodology is done in 5 modules. The first module is ISS, that is individual self-screening, whereby the community members or the target group are trained on what factors to consider in an individual they want to form a group with. And then the second module is group formation and leadership. The third module is group fund development. The fourth one is constitutional development, and finally record keeping for the purposes of transparency and accountability.
The groups are made up of 10 to 30 members based on their trust. It is then agreed on how much money each member contributes weekly or monthly according to their ability and the interest rates to be charged on the loans. Members take the initiative to ask for loans which are given out during group meetings. Collective repayment of the loans is enforced by the group's constitution and peer pressure. Liquidation takes between 9 to 12 months. At this point, all the savings and interest are shared amongst the members according to their total individual share value, total members share value and the net worth, after which another cycle starts and the members are free to take loans. Group members are encouraged to have two types of savings funds. The first fund is the loans fund, which is meant for members' productive and non-productive users. The second fund is the social fund, which is for social emergencies such as sickness or even death. What was life like before Care Kenya introduced the Economic Empowerment Program?
In Kisumu Rural, there are no formal banking systems, and even the microfinance institutions are very limited. This only leaves the community with only options of asset savings, and at times, majority are involved in the merry-go-rounds as a form of savings.
The nature of Kisumu West district is that of a very dry region, very rocky, and even the farms are not really fertile to produce tangible products. This is also a region that is characterized by so frequent droughts and drastic weather changes, and all that factors coming into play made this community very, very vulnerable.
The savings and credit culture has given new hope to the vulnerable children and their caregivers. They have experienced increase in the standard of living, health, and joy.
Eyot kaendi bende naneno ka an gi chandruok nikech samoro nanyalo riyo kech wanindo kamano, to sani holo kod kungo kabiro taholo tadhi ang'iewo oduma gunia, nyithindo chiemo maber, girwakore maber, naneno ka lokruok ni e ngimana.
Nayudo ot lakini mana gede yamo ne ng'eny mane chanda gi oda no ne goyo piny. Koro naolo kuom jo group manaolo siling 5,000 ba ng'iewo godo simiti ma muono go oda no oko. Koro naneno kamano nokonya. E group achiel no ne an kod gombo mag gik moko monego bed ni abet go, to nokane kaka nyalo yudo. Nachako aolo kendo 3,000 ma loso godo kabat nikech nachandoga kama nyakane giga. E group achiel ni osekonya nikech nabedo kod problem mar wang' mane gi hola ma adhigo timnago operation. Mano naneno ni group nokonya. Group konya gi yore mang'eny nikech kata e oda kaka dak an gi nyithindo madhi skul, to an e baba gi to an e mama gi. Koro samoro ka aolo pesa no tadhi awaro godo mo, mchele, nyanya, omena, gik makamago tabet go tauso. Bende ayude school fees manyalo tero ne ja school.
Bas group mar kungo gi hola osekonya kanoweya gi nyithi kiye 5 ma min gi wuon gi otho. Koro ne ai ka donje kungo gi hola tayudo pesa matin, tawaro go gik moko taloko, to nyithindo chiemo e yo maber, to koro an bende akonyora e yo maber. Achandora kaka dhano nyalo chandore, tayudo matin kuom kungo gi hola to konya. Kinde duto emosekowa gi nyithindo nyaka sechegi.
Girubwa mar Cosamo Plus ni osekonya kuom kinde mang'eny. Konya achulo ne nyithindo gik moko, gik mopogore opogore. Chiemo bende nyithindo chiemo maber nyaka nadonje. Uniform anyiewo ne gi fees bende achulo. Omiyo osekonya, aseneno pogruok mang'eny. Ohala bende osemiya asenyiewo diek atweyo.
Jaodani kano donje kungo gi hola naneno ka koro ber nikech okelo na kwe ot ma kwe koro nitiere. Miyo era mane wachako kode mokwongo ka wathagore cha aneno kodok na chien, kendo akawe kaka ng'at mahero malich, ma nikech kowuok to duogo kelna gima chamo mitna kendo ahere sipidi mang'eny.
Nyaka ni mamma donje kungo gi hola tindo winjo maber. Ochulonwa school uniform, school fees bo ochulonwa.
Nan gi liel, chiyo wadwa notho, to naonge pesa. Naringa dhi e group, bagi hola siling 1,000, ba dhige liel no, ba tieko liel. To gima nayudo ni group mar kungo gi holo nyalo konyo ng'ato koyudo masira.
The trainings provided by care-trained community-based trainers has sparked entrepreneurial skills among group members. With the small loans, members have been able to venture into various businesses, buying goods and selling them at a profit. Others have turned back to agriculture, purchasing farm inputs to increase their yields. This has seen farmers providing fresh produce to sell in the market, as well as ensuring that their families have the much-needed vitamins. Economic development has become a key component in all the sectors, because once there are finances in each and every household, then all the other sectors are met. One is able to pay school fees, buy food, and meet all the basic needs. Automatically, lives are improved at household and community level.
We have seen changes among the Gurjias and L group members. We have actually been doing focal group discussions, and we have seen women who have built houses. We have seen OVC caregivers who are now able to put food on the table. They are able to take their children to school, they are able to buy school uniforms, and they are also able to access medication for their children. And that's very important for this project.
The project to date has managed to reach over 4,500 participants. These participants are organized in 300 DSL groups. The cumulative savings portfolio as at now, that is June 2010, is standing at 4.7 million Kenyan shillings. And the loans portfolio cumulatively is standing currently at 9 million Kenyan shillings. We have already 16 community-based trainers who are already trained and are rolling out both trainings in group savings and loaning methodology, as well as SPM, that is Selection, Planning and Management of IGAs. Out of the 4,500 participants, 75% of the same is already engaged in different kinds of income-generating activities. The capacity building that is done to these group savings and loaning members, things to do with trainings, leadership skills, record keeping, mentoring and all that, is making them stronger enough even to withstand the project's absence from their area. You also notice that we have community-based trainers. These are community members who are living among the community members, and they are not living when the project is going, and therefore they would still provide such trainings that they've been trained on. So you'll find that the project would be sustained even when the project itself has phased out from the community of Kisumu West district.
I have a vision that even if the Kenya people will leave the Cosamo Plus project, I, as a CBT, I have the vision to continue mobilizing, teaching, and doing follow-ups to our community to make them expand more on the methodology of group savings and loaning.
With the ongoing training and community participation, ultimately, the community members improve their business skills, their incomes increase, their business thrive, jobs are created within the community, and families and the entire community benefits. Caregivers can now easily afford school fees, provide improved nutrition and adequate health care.